leaders in manufacturing and sales of hospital furniture. So our bread and butter products include hospital beds, crash carts, stretchers, wheelchairs, examination tables. So overall, anything that a hospital setup would require, primarily from a furniture standpoint.
Mm-hmm.
And we were founded in 1951, and we have been market leaders for the last 60 plus years.
So you are a second generation entrepreneur?
No, I'm a promoted employee of a company called Midmark Corporation. Midmark owns 100% of Janak, and Midmark is based out of Ohio in the US.
Oh, I see.
So no grants here. I didn't get anything handed to me. It was hopefully earned through performance and hard work. So.
Oh, really? Okay. And what's the kind of market do you see in India? Do you also export to other countries?
We do. I think so. These are two different questions. One is how's the market in India, and do we export? The market in India is very attractive.
Mm-hmm.
So when you look at the number of hospital beds that are sold every year in India,
mm-hmm.
and some of the statistics around beds per thousand population in India versus other countries, it's not a very good picture in India.
Low.
It is abysmally low, as you rightly said. India has, I think, 1.3 beds per thousand population as of a 2012 report published by McKinsey. Global average is 2.6. WHO recommends 3.5 beds per thousand. So you can just imagine between 1.3 to getting to 2.6, how much more do we need in terms of just the sheer number of hospital beds? And we believe that India is going to buy around 100,000 beds every year for the next 10 years. And still will only come close but not reach 2.6 beds per thousand population by 2025.
But then has the new private chains of hospitals helped the matter in this particular regard?
And that's why the market is very attractive. So going back to your previous question, the market is attractive because people see that shortage, right? And a lot of private entrepreneurs have come in this industry in the last 15, 20 years, mm-hmm. Which has really helped.
Mm-hmm.
But private entrepreneurs by themselves are not going to be able to fill this gap. And that's where I think government intervention is required, and government is becoming more active. So we have seen the last couple of years, the government is buying a lot more than they used to buy 10 years back. Okay. And so we have made some structural changes within the company to make sure that we are also paying attention to not just the private customers, but also work with our government partners and make sure that we have the right products for them as well. So the market is attractive. A lot of foreign companies have come into India in the last
mm-hmm.
few years.
Mm-hmm.
But our aspiration is that not only should we remain the top company in India, but our products should be sold globally. So to answer again your first question, yes, we export. We export primarily to Middle East, Africa, but it is not, as deep, and as widely spread globally as I would like it to be.
Okay. Now, in that case, what basically are, in comparison with the other products available in the global market, will you have a straight price advantage?
Outside India?
Yeah.
Well, I think the Chinese guys take the cake, for the price advantage. We were never the price leaders, but our vision is more, geared towards providing world-class product at affordable prices.
Okay.
But are we the cheapest in the world? We are not.
Okay.
Are we the cheapest in India? No, we are the most expensive in India, amongst other domestic manufacturers.
Okay.
But do we have a price advantage over some other multinational companies that come in West, Europe, you're from Europe or the US?
Mm-hmm.
Yes, we do have a price advantage there. But when you're exporting, you really have to make a choice as to how do you want to position your company. And I believe that we should attempt to position Janak as a company that has products that can compete with the best in the world. So it should not be based on I'm the cheapest, so that's why you should buy Janak. It should be I am the best product available for the feature set that you're looking for globally, okay, at the best or the most attractive price.
So in terms of comparisons with the foreign products, especially European companies, which which bring in their products here. How will you compare your quality with them, and what is your USP in that regard?
I think it's comparable. We have been in India in the hospital furniture market for 60 plus years as Janak. Midmark, our US parent, has been in the healthcare industry for 100 years. This is our 100th year. We're celebrating that. So we really believe that our products are second to none. From a quality standpoint, I remember hearing from the founding fathers when we were working together that the founding fathers really, and their previous generation, so the founding fathers were the Mehta family, and their generations have really been in business for a long time, never compromised on quality. When the business was founded, I believe Janak was the first of its kind. Earlier, I think a lot of hospital equipment had to be imported, and the process of importing the equipment was pretty cumbersome, including getting permissions from RBI and all. And so when these guys started manufacturing in India, they really could have charged a significant premium because they were saving the hassle of going abroad, but they never did so. So they always charged what they felt was a reasonable price, producing the best quality but keeping the prices affordable. To answer your question again, I believe that our products are second to none in terms of quality.
I see. Mr. Vijay Paliwal, you referred to the government policies. Are you disappointed with the fact that the government spending on healthcare is going down, and that is going down, even by standards mentioned abroad in Lancet? There was an article also mentioned saying that it shouldn't happen and it should improve rather than go back. So, will industries like yours be also be hit because one of your major buyers would be government sector?
Right. Nobody knows what the right percentage of spending is, but I know that it's not enough in India. Okay. So our GDP, our healthcare, as a percent of spend as a percent of GDP is around 4 to 5%, I think, of which 1% comes from the government. Okay. Which, again, my thought process is that it is low, given the statistics we have, the challenges we face. Forget about healthcare infrastructure. Let's just think of basic, clean water, sanitation, right? Looking at the root cause of what makes people sick.
Absolutely.
You can really treat the symptoms. So you can open 1,000 more hospitals, produce 10,000 more doctors, and it's fine. But we need to take a few steps back and have a national policy on and a large amount of funds dedicated to controlling the causes of some of these diseases. So when you look at some data, which is difficult to digest, but not only is India still working on its sanitation, availability of clean water and overall breathable air, but we are also growing rapidly in terms of chronic diseases. So 50 to 70% of chronic diseases occur in rural areas, which 50 years back nobody would have believed, because we always assumed that people who live in rural India are the healthiest,
most healthy.
Because the guys living in city are breathing toxic air, and their lifestyles are not as healthy, and the guys living in rural India are healthier, and it's not true anymore. So it's a matter of grave concern, and I believe that we need to, government especially needs to intensify their efforts, not only in words but also in action, by committing bigger funds for healthcare.
So the fact that we are not only leaders in infectious diseases, but also in terms of non-communicable diseases, also India has now taken the lead.
Yes.
So in both ways, it's a double whammy for us.
Absolutely,
right?
You're right.
And what about other governments like state government or the local bodies? What is your opinion on how they are spending their money on healthcare, and how better to do it? Because I believe last year BMC started a very good trend of scanning all diabetics, especially in the lower strata.
Right.
And they found that nearly 40% of them are in the borderline cases.
Mhm.
It is dangerous.
Yeah, absolutely.
Not even alarming, it's dangerous.
Yeah.
So in that regard, how is the situation according to in terms of your sales and your business? What's your feedback you get from local bodies, not just in BMC but across?
I think there is increasing awareness. I'm not saying that the government is not putting in effort. And I also believe that the decision to reduce the healthcare spending was because the budget was not getting consumed. So on one hand, if I were running the country, I would do the same thing. If I'm giving you 2% of my projected GDP as healthcare spend, and if you're only consuming 0.7% or 0.8%, you don't need the other 1.2%. So I'm going to redeploy that fund elsewhere. So the funds have to be consumed completely, and I believe that the state governments are waking up to this fact. Especially around elections, you see a lot more activity in all sectors, including healthcare. So our sales go up to the government sector.
In other magazine, developers would say, infrastructure developers would say, it will be good if we have elections every year.
I think that's a good one. I'll have to remember that. Yeah. So we also see that effect, which is so there is intent. It has to be spread evenly, and the bang for the buck has to be measured. So if you're spending 100 rupees, where was the money spent? How was the project managed? What was the outcome of that spending? If we put some of these metrics in place and start measuring our bureaucrats, even if we don't, reward or penalize, because I understand that promotions are based on experience. I think just the fact that if you will collect that data or publish it, will make a difference.
One more question in policy before we get into the other things is that there is also increasing number as well as government's emphasis on PPPs in healthcare. You being somebody from the who works in the ground at the ground level, at the grassroots level of healthcare industry, what has been your experience in the last decade? Have things improved in PPPs, and are private companies really ready to team up with the government on healthcare?
I think PPP is a good idea in concept, but very difficult to execute in reality.
Okay.
The initial negotiations between that private entity and the government will outline a lot of things, what the government expects, what the private entity is committing.
Okay.
So there would be a lot of things that will be agreed upon.
Okay.
But the process of monitoring that, the process of getting funds from the government, all of these things make the overall survival or even the initiation of these PPP projects very difficult. And some companies do a good job at it and others don't. So yeah, I think PPPs are fine, but I believe that the role of the government is to be not in business. They should just stay out of business. The government has no experience in business. They are bureaucrats. Okay, they know how to govern. They are not in the business of making profits and redeploying the funds. So let people who know how to do it. So if the idea of PPP is that the government is financing someone, let it be a financing deal. Let's not call it a mega project between government of India or government of Maharashtra and private company A. Give them a loan at a good rate. So if the person needs 100 crore rupees for a hospital in a rural area, give them that loan, at no interest for the first 2 years or something. So come up with those things and let them, perform freely, versus, attaching strings like 20% of your beds have to be used for rural, people of low income. Because when you attach too many strings, then to monitor those strings, you'll have to hire people who may or may not do their jobs. Those 20% guys may or may not feel welcome in those hospitals, so those seats may still be getting consumed, or those beds may still be getting consumed at 5,000 rupees a night. So all this becomes a monitoring nightmare. Versus if the government focused on being a financier, you provide universal health coverage. Let people choose their hospitals, whether they go to a Hinduja or they go to a other hospital, trust hospital, it's their choice. And you will see that the quality of healthcare will improve. It's very expensive. It's not cheap. I know it's not easy. Otherwise, we would have done it so far. But the answer is in the government being a financier versus a business player.
Okay. Now, in a nutshell, if I, because we send our copies to all the state governments as well as the central ministries.
They'll be happy to read this.
No, we need to give them basically a message on what kind of policies we need. Actually, we are also planning to have a white paper early next year on diabetes alone, because we deal only. So in that regard, what would be your suggestion as a and as a person from industry on healthcare spending, or even on case of the PPPs, or you talked about any kind of policy issues that you can suggest 3 things to the government?
Related to diabetes or in general?
Related to diabetes, and of course diabetes would involve almost all the.
My expertise is not in diabetes.
No, in healthcare.
In healthcare, okay.
Healthcare, yeah.
Okay.
In hospitals dealing with diabetes and its related, heart, kidneys, those kind of hospitals. So, what kind of things could help in setting up more hospitals? What are the issues related to that, and how to solve them? If you must be having the ground level experience of dealing with them. So once in a while you would have felt if this policy was not like this, or if this policy weren't there, it would have been much easier for making healthcare accessible to so many more people. So what are those points that you would say?
So I would categorize all these diseases in one category, chronic. Okay. And we know that India is going to be challenged with, and is already challenged with, a huge number of people with chronic diseases, including, heart issues, diabetes, so just lifestyle diseases. And there is no magic bullet, but there has to be, a systemic change in how we, solve these challenges or look at these challenges.
Mm-hmm.
So, I made one point earlier about, the government not attempting to be in business. So if government programs could provide coverage to population that does not have too many strings attached. So you could, if you're sick, we will, work with you to cure you. So when you look at the health system in the UK, NHS, right, it has its own advantages and disadvantages. Versus a system in the US where there is a very large portion of population with private insurance. I trust the US system. I have insurance coverage in the US, but I also believe that the greater good is in the NHS system, where a population, everyone is guaranteed to be looked at. The problem is that it takes a long time, right? And UK's population is nothing compared to India's population. So that is going to be a challenge. But I lean towards providing, coverage to people so they at least have the option to walk in and show that I have this card, I have this problem, can you see what's going on, right? So that's one, the financing aspect. Okay. The other is awareness. When I was a child growing up in India, I remember Doordarshan used to have a lot of little ads, cartoons and all, conveying, social messages. And those things stayed with me, for a long time. And, television is a good medium, but, we have internet these days, people can watch things on YouTube, you have ads that play before fancy video on YouTube. Sure. So can government spend some money on creating awareness through TV, internet, in rural areas? It could be hoardings, newspaper leaflets.
On phones also.
Yeah, on phones, messages, SMS, around, behaviors to avoid or things to keep in mind, so that you don't get sick, So don't drink, tap water if it's not clean, or government has to provide clean tap water, right? Wash your hands. So just little things, where overall I think we'll start to make a bigger impact in the long term. So that would be number 2. And number 3 is really ensuring that we hold institutions accountable, right? So the ones that we have, they have to be more efficient, they have to be more quality focused. So I don't have any data on this, but when you go to any public hospital, the average waiting time probably for someone to be admitted and get a bed is probably a few days. You just don't walk into a public hospital and get a bed, right? And this shortage, leads to corruption. Okay, and that's where people with resources, with connections, are able to get something that others who don't have resources or connections, which is very unfortunate. So, accountability and controls will drive or hopefully eradicate, such issues where, the better systems could be put in place that whoever wants, a bed is sick, either gets a token or something, or, when their token is called, that's when your number comes. But also looking at the, improving the effectiveness of what we are doing by monitoring the quality of what we are doing. So nobody really publishes any, metrics.
Okay.
So do you know that the hospital down the street where you live, which is 50 beds, is that better or worse than a 300-bed fancy hospital a couple of kilometers away? So you perceive that when I'm sick, my son is sick, I'm going to avoid, if you can afford it, I'm going to avoid this small hospital down the street and take my son to that fancy hospital because you think it's nice, because you see granite, marble,
Sure.
You see a nice lobby. So it's in your mind that that hospital is better, but how do you know? They don't publish their outcomes. Maybe this nursing home is better than that hospital. Similarly with government hospitals, just because somebody is poor.
You're right, because doctors in government hospitals are much better than
Exactly. So, but the ecosystem does not allow that brilliance to show, right?
Absolutely.
So, how do we create that accountability by publishing, data and metrics on the outcomes? Just because somebody is poor does not mean that that person deserves poor healthcare, poor quality of healthcare. The quality of healthcare should be the same whether you are getting it, I'm getting it, or a person living in a slum getting it.
Fantastic.
So these are some of the recommendations I would have for the government.
Great. 3 great points.